Hello, welcome to the East Carolina University Combined Medicine Pediatrics Clinic. My name is Lacy Hobgood. I am the medical director of the clinic and the division head of internal medicine pediatrics here at the Brody School of Medicine. I would like to share with you some details about our clinic and talk about your opportunity to work in our combined medicine pediatrics clinic. Every combined program has to have a clinic experience. In some programs, they have you alternate between a medicine clinic one week and a pediatrics clinic the following week. At this institution, we're fortunate to have a combined clinic that's open 5 days a week, mornings and afternoons. You would come over to the resident clinic in the afternoon, one session per week, assuming that you're not working nights in the ICU or certain other inpatient rotations that have a very high hospital work requirement. Our goal is for you to see both children and adults during every clinic session. The very first time you're here as an intern, I'm going to have one adult and one child on your schedule. And then once you've proven to me that you're able to navigate the electronic health record, we will increase the number of patients that are scheduled per clinic session. By the time you're an upper year resident, you'll be seeing 4 adults and 4 children during every clinic session. Now, your attendings will be here in the mornings seeing patients, and every so often we'll have an upper year resident working with us in the mornings as well. And what's neat about that is this clinic serves as the safety net clinic and the teaching clinic, but also the private medicine pediatrics faculty practice. So you're going to end up seeing a very broad number of patients from very diverse backgrounds, which is very exciting. There may be times when you're seeing Medicaid patients. There may be times when you're seeing Medicare patients. There may be times when you're seeing TRICARE patients. There may be times when your attending is not able to see his or her own patient because they're busy doing other things, and you may end up seeing one of the attendings privately insured patients. So you end up seeing a really big mix of patients during your time here, which is very exciting. All of this really points to a system of graduated responsibility. When you're an intern, every patient you see, one of the faculty members will also see, and we'll be right there with you and guiding you through the process and making sure that everything that needs to get done is getting done. And it's easy to see how this works in the clinic. One of the things that often first-year residents don't think about is all the things that happen between clinic visits, because we're going to assign you a panel of patients, and you will be the primary care physician, and you'll be responsible for everything that happens, not only during a clinic encounter, but also between clinic encounters. When patients call in with questions, I'll expect you to be able to answer them. When patients have labs and they have questions about labs or we need to change a treatment plan, I'll expect you to manage that as well. You will always have backup. You will have senior residents who can help you. You will have faculty members who can help you. And as the medical director, I am the ultimate backstop who will answer all questions that cannot be answered by anybody else. By the time you are a senior resident, I expect you to be able to manage all aspects of outpatient primary care for both children and adults. That's what we will be teaching you in the Medicine Pediatrics Clinic. We're capable of doing all the things that are important for chronic disease management, that are important for wellness visits, and that also are important for the management of acute conditions or acute concerns in both children and adults. Now, at this point, some of you may be thinking, that sounds fantastic, but I don't want to be a clinic doctor. I want to be a hospitalist. Or it could be that some of you are thinking, I don't want to do primary care. I'm planning on being a subspecialist, either a medicine subspecialist or a pediatric subspecialist, or maybe both. Well, in the clinic, we're going to teach you skills that can be applicable in all of those situations. In addition to learning how to take care of patients, we're going to teach you how